Infinity. Today we will be here and I'll be showing you guys how to do patient intake on hospitals and clinics, or if you was to go to the emergency room, the process of being a patient in intake. Hi, Ms. Edwards. Come with me to the back. Now I will begin all Ms. Edwards' demographic information, also all her insurance, and if there's additional insurance, and then we'll have her sign a few consent forms just for patient treatment. If there's anything else that is needed, Ms. Edwards will come to the front or let me know if she has any questions regarding the process of her waiting to be seen to the back to the doctor. And then I will just get her consent forms and put all this in her chart to go in the back for the doctor to have on file. Thanks for watching, guys. This is how you do patient intake in a doctor's office or in a hospital.
Hi, my name's Alea Regali, and I'm here to show you how to take proper weight and height. I go to school at WVJC, and I am a CMA. So first, my patient here, she's gonna have to step on the weight scale. Okay, so my patient has stepped onto the scale, and now I'm gonna be writing down her weight. And then after that, I'm gonna need her to turn around to face me, right here. Okay, and then I'm going to get her height. I need you to back up with your head back. Okay, you can step off. She is around 70 inches. And then I'll get my next patient. Come on, next patient, I'm gonna need you over here. Can you please step on the scale? Okay, and then after that, I'm gonna need you to turn around and face the back. Step all the way back. Okay, good. And then she's gonna be around 65 inches tall. And then after that, I will grab my next patient. Okay, will you come step on the scale for me? Yeah. Okay, and then after that, will you turn around so I can get your height? Okay, you're good. And then you're about 66 inches tall. Hi, my name's Alea, and that's how you properly take height and weight, and come back for the next video.